talking about work that I do using smartphone data collected from a massive sample, thank you, of residents across the US. We have around a 5% sample of the population across the country and all of their geolocations. And you can use that for all kinds of things. And we use it to study eating behaviors and how people's dietary choices are influenced by the environments that they spend time in. And essentially, if you've heard of like food deserts, how these kind of environments can influence the options that people have and the choices that they make. Now, I will get into it here. I just wanted to also mention that I'm also have a position as a co-director of the Center for the AI for Health Center that we've just recently started at ISI, and we have connections. And we're with ShowCAIS, and so we're doing more and more on campus as we grow. So just a little motivation. So poor diet is a huge problem. There are more deaths from every year attributed to poor diet than there are to any other single risk factor in health, because poor diet leads to most of the chronic diseases that we see. And it's not just about overconsumption, it's a lot of underconsumption of the recommended nutrients or overconsumption of restricted nutrients. The one at the top of the list there is sodium. And so there has been a shift, there has been a good shift in the focus in terms of how do we improve diet, from focusing on the individual and telling the individual what to eat or doing interventions to improve things for the individual, to think about the individual embedded in the larger system of systems that influence eating, including their social network, the social environment and cultural environment, as well as the structural environment, which is the food outlets that people have access to around their home, their workplace, schools, etc. And then all of this embedded in the larger macro level system where we have food policy and food industry and advertising influencing decisions. Now, of this whole system of systems, the work that I'm more focused on right now is around the structural food environment, the food outlets that people have access to. And again, I keep on saying food environment, that's the term used to describe this set of food outlets that people have access to around the different places that they spend time in throughout their day. And there's been a lot of research in this area. I have that citation there from PubMed, over 1 million studies on the food environment. And the overwhelming majority of these studies are on the neighborhood food environment. And we normally think about these low, from a public health perspective, we think about low quality food environments and low quality neighborhood food environments. So we are assuming that people are getting most of their food in the home, in the area where they live. And we can look at these low quality food environments such as food swamps, which are areas with a super high saturation of low quality food outlets like fast food outlets that sell mostly ultra processed, low nutrient energy dense food, or food deserts, which are areas where we say they have low access to healthy foods, which is generally operationalized as grocery stores where you can get fresh fruits and vegetables. So fresh fruit and vegetables, healthy. And we know that these kind of environments can influence people's dietary decisions because of the access that they provide or that they don't provide if they are or not available, and also psychological cues. We also know that these types of environments are very unequally distributed across different populations. If we look at home neighborhood environments where people live and where there are higher prevalence of food deserts or food swamps. Except that when the focus is just unilaterally on these neighborhood food environments, the food environments that people have around their homes, there's really a lack of evidence linking these home neighborhoods with actual, the quality of the environment, the food options that people have around them, around their home, linking that to their dietary decisions and their dietary health outcomes, actually. And one reason for that we think is that we are missing a much bigger part of the context. So we're generally focused on the home and the food outlets that people have in that area. Whereas, and if we look at things like the food desert indicator, so you've probably seen maps like this, 17% of the US population lives in a food desert. So this is all based on the home neighborhood. But we know that people spend time in food environments that go well beyond their home throughout all of their day-to-day trajectories. And when we actually look at the mobility data from smartphones, we can see that the average distance to a supermarket from someone's home location is 3 kilometers. The average distance to a standard fast food outlet or any other kind of restaurant is around 7 kilometers. And both of those distances are much greater than the distance to the centroid of their census tract. So if we're just studying people's home neighborhood, we're missing most of the places that people are actually eating at throughout their day. So that's why we were thinking, okay, could we use mobility data to do this? And mobility data also gets around some of the other limitations of current research that is trying to measure. There are some other studies that are trying to measure these dynamic food environments that go beyond the home neighborhood, but they're normally really small studies that are limited in scope to like less than 100 participants a week of observation. We can do a lot more than that with this super longitudinal smartphone mobility data. And when I'm talking about this data, what it really looks like is we have these kind of anonymous user IDs, we have the timestamps, and we have the geolocations of these points. And then we can link that to data on points of interest. So where people, where there are food outlets in the environment, and other points of interest throughout the community. So we can see people's whole trajectory throughout their day when they go to food outlets in the context of the other places that they visit throughout the day. And I'm just kind of setting up all of the research that we're doing. We have several big papers that have come out of this, but our two main research questions getting into this area. The first was kind of a validation study to link the mobility data, visits to food outlets and the mobility data with dietary health data. So basically we want to say, okay, I can measure people going to food outlets. Does that tell me anything about their actual dietary behavior? They're actually, if someone's going to a food outlet, a fast food outlet, are they eating fast food? And we're doing this all at the population level. So just take that example to the population level. And is this related to diet-related disease outcomes? So that was the first study. And then kind of once we have that in place, that's a validation that yes, this mobility data is telling us something meaningful from the perspective of nutritional health. And we can use the mobility data. We can dig a lot deeper in the mobility data to really investigate how people are influenced by the dynamic food environments that they spend time in throughout their day. And so that's what we've done. And we have a couple papers out on this that I am not going to get into right now. So I think I'll leave it there. This is the first study. The second, this is the validation study. They're both of the papers are currently under review, but they're both on medRxiv. And what was I going to say? Yeah, the cool thing is that we can use the mobility data to really identify where people are influenced by their environment. We can use it to just do things like design natural experiments, such as when people move home locations, or when people are put into kind of random places in the city throughout the day, such as like, what's a random place that everyone has to go to that people don't really have a choice over where they go, but people are subject to the food environment there. A place that we chose with the DMV. So everyone has to go to the DMV at some point. And so it kind of acts as this natural experiment. We can see people in this random setting. And so the mobility data gives us all the opportunity to design these kind of studies. So I guess that was kind of like a plug for using mobility data to study dietary disease data, dietary behaviors. But I think it's a really exciting area of research, and that's what I'm going to say. So.